Doctors of Reddit, what was the worst thing you've seen for a patient that another doctor overlooked? Rattlesnake bite. On a 2-year-old. Patient and dad out in the fields near a small town that is several hours away from the nearest big city. Where I work. Dad takes the child to the ER in the small town with an obvious snake bite. Doctor there says it's okay, she probably didn't get envenomated. Doesn't give the patient antivenin. Which they had at that hospital. And instead of electing to send the child to us by helicopter, he sent her by ambulance. Several hours later patient shows up to our hospital coding. And ended up dying. Probably didn't get envenomated? What the kind of stupid ass idea is that? If a tiny child gets bitten by a rattlesnake, you assume they've been envenomated and you treat them as though that had been. That means antivenin, physiological support, etc. Completely absurd. He put the pacemaker lead in the subclavian artery and across the aortic valve into the left ventricle. The proper approach is subclavian vein to right ventricle. And then he didn't notice it for over a year. I saw the patient, a 25-year woman who didn't need the pacemaker in the first place, when she was in congestive heart failure because the pacemaker lead had destroyed the valve. A surgeon and I had to do surgery to remove the pacemaker and lead. Then replace the aortic valve. Totally inexcusable. Well, 50% of doctors are below average. Neurologist sent patient to our ED without informing her that imaging showed a glioblastoma, assuring her impending death. He didn't overlook the disease. He overlooked the communication. MD here. Recently was called over by a nurse who told me a patient's bandages were wet as they were bleeding a little. Patient had recently had his leg amputated. We pulled his bandages off and found a spurting femoral artery. At this point the patient passed out. Patient was sent to theaters for an emergency operation. Close call for sure. I found an obvious huge rectal cancer on a patient who was previously told over and over again that she had hemorrhoids. In residency I saw a cardiologist miss a STEMI heart attack. By the time the patient came to us, some of the muscles supporting one of his heart valves had completely died and he was in cardiogenic shock. Basically his heart function was so bad that it wasn't circulating the blood in his body enough to support life. It was awful. Happily he made it through though. Once when I was a medical student on surgery rotation in trauma, we had a patient come in after he fell on the street and bonked his head. Well, apparently he had fallen once earlier that day and was discharged when the trauma workup at the other hospital was negative for injuries. We examined him and noticed his eyes were kinda yellow. Though as part of our trauma workup, given that he couldn't give a great story and we couldn't be sure what happened, we CT scanned his abdomen and saw his common bile duct was like 3 times normal size. Could drive a truck through it. About the time. Next set of vitals, his temp was 103 F. Guy was floridly septic from ascending cholangitis, which is why he was falling down. Big miss, and that is an emergency. Young student from, I think, Pakistan. He was complaining about his neck feeling stiff. He went to a doctor some days before and he was told he was having joint pains that would pass with some common anti-inflammatory drugs. When I visited him I saw many of the lymph nodes in his neck were swollen, which probably caused the stiffness, and not painful, not a good sign. Sent him right away to have a chest x-ray that showed a huge mediastinical mass. Suggestive of lymphoma. Sadly I don't know what happened to him. I'm an emergency medicine physician. I think the biggest miss I caught was a STEMI. I took signal from the previous doctor. Then I usually go through every patient's labs, imaging, and EKG. Found an EKG that showed a massive heart attack that was done about 8 hours prior. By the time I took over the patient no longer had pain. The new EKG that I got was more normal. And the cardiologist didn't take him to the cath lab. I work in EMS. We got a call for a female with leg pain. When we arrive on scene, this woman's leg is 3 times the size of her other one. Blue and purple. And she has no pulse in her foot. She fell on ice a few days prior and the urgent care didn't do any x-rays. Told her she had a sprain and gave her a walking boot. In reality, her tibia and fibula were both so badly fractured they were cutting the blood vessels and muscle tissue. She lost her foot. One that comes to mind is when I was a resident. The ED doctor wanted to admit a mild septic patient with a UT. I review her labs. And knowing that she is a diabetic, it was obvious florid DKA, diabetic ketoacidosis. That kind of admission typically goes straight to the ICU to get insulin via a drip and aggressive IV fluid rehydration. She was just in the ED hallway with no medications at all, looking like crap. AIDS. As in, the patient had no working white cells whatsoever. It all started with what appeared to be a fungal infection in the chest, but after many pulses with itraconazole the plaque was still present and growing. So the physician called me to check the patient and the chest plaque was indeed very suggestive for a fungal infection. The direct examination even confirmed the existence of the fungus. But the treatments were doing nothing. So I rechecked the file and lo and behold, the leukocytes count was quite low. A quick HIV test later and the patient was diagnosed with AIDS on top of its body fungus. To the credit of the physician that called me, the patient lied on the clinical exam as he marked he had no active sex life. But when confronted with the evidence he spilled the beans. Turns out he was a regular with the local hookers. But also quite active in online dating. They told him go home, it's nothing to you. When he came to me we barely saved him, he had a ruptured appendix. I'm a dental assistant and a patient came in and his color was off. His jaw hurt and a tooth. He'd just come from the DR. Who told him to see us? I was suspicious of heart attack. I put the pulse ox on him and almost fainted myself. 82%. I grabbed our emergency high flow and yelled for the Eden 911. The guy was having a heart attack. A guy lived and brought me a big old heart-shaped box of chocolate at Valentine's. I've never been so scared or angry for another person. The dentist I worked for called the MD and said, "My 25-year-old assistant just saved your patient's life." Medical student here, will be doctor in May. Working an ED shift we found what was probably a missed testicular torsion. Previous doctor told patient he probably had cancer. When he showed up at our ED, what he had was probably a dead testis missed at initial presentation weeks prior. People with testes, especially young men, few have sudden onset excruciating pain. Sometimes without activity. Often after during activity. Go to the ED immediately. It's one of the few things that would make a urologist lounging at home on the weekend turn on his Tesla ludicrous mode and go plaid to get to the hospital. Edit. Much love to urology. Edit 2. My patient experience was with a male. But indeed ovarian torsion is a similar emergency. Patient was lactating but not pregnant or breastfeeding. Previous doctor told her it was residual from her baby that had been weaned for 14 months. Sent her immediately for a brain scan. Brain tumor. She had surgery a week later to remove it and is doing very well now. Edit. Whoa. I didn't think anyone would even read this, or I would have explained better, tried to sound a bit more professional. I did not do any of the follow-up care. She left my office with a referral for an MRI and a referral to an endocrinologist, who took over care. Also, please, if you are concerned about your health in any way or are not happy with your doctor care, obtain your medical records and bring them with you to a different doctor. Don't solicit medical advice from strangers on the internet that know nothing at all about your medical history. That is very dangerous to your health. There was a story pretty recently in the hospital I work for, where a cardiologist in the ER was doing a rather difficult night shift and started feeling lightheaded, dizzy and fatigued. Given how intense those shifts are, 26+ hours, sometimes multiple times a week, nobody thought much of it, and the doctor in question went to catch a quick nap in the staff room. People just passed by him in the staff room every once in a while, but they just assumed the poor guy was exhausted and let him rest. He was dead for several hours by the time someone realized something wasn't right. Life pro tip. When seeking a second opinion, don't tell them it's a second opinion. You want a second first opinion, not a confirmation of the first opinion. I have been to multiple doctors who would not contradict the diagnosis of another doctor, even with test results that ruled out the initial diagnosis or confirmed a contrary diagnosis. I have a story in the opposite direction. A woman came into the ED for extreme fatigue and spontaneous bruising. They checked labs and saw low white blood cells, red cells, and platelets. They told her she has leukemia and will need chemo, without actually doing any confirmatory tests. They admit her to my service. She is crying and screaming in fear. Get more history and find out she was just started on a medication for her rheumatoid arthritis that can cause decreased blood and platelet cell counts as a side effect. Did some further workup and found no evidence of leukemia. Stopped the new medication and within a week she was completely back to normal. Pharmacist here. I was verifying a refill prescription, second fill of the medication, for a patient, when I realized that a different pharmacist who had verified it a month ago had mistakenly allowed pantoprazole to be dispensed instead of paroxetine. It wasn't fun explaining to the patient that instead of getting an antidepressant for the last month, he had been given medication for acid reflux. It had been a new medication for him, so he didn't know the name and didn't question it. Not a doctor, but my grandmother saved my father's eyesight because she didn't listen to their doctor. As a child, my father had really large eyes. Too large. My grandmother was concerned, but the doctor kept brushing it off as normal. That anxiety-ridden woman got herself and my infant father on a train to SF to get to an eye specialist. Against all others' advice, my dad was diagnosed with primary congenital glaucoma and his eyesight was saved. Go grandma. When I was a resident, an 80-year-old female was admitted from the nursing home for confusion. Workup showed some mild UT and we were giving her antibiotics. The nurse mentioned that her toe looked dark and asked me to look at it. The toe wasn't just dark. It was mummified. It looked like dry beef jerky. I touched it and pieces flaked off. So the patient from a nursing home had a mummified toe. Probably for months. That no one knew about. Patient getting anxious about numbness in his hand. It's getting more frequent and I don't want to live like this. It gets me freaked out like my hand's not there. They assumed the person was suicidal and having symptoms of panic attack, elevated breathing rate, tingling numbness in hands. They did a CT because I requested it. There was a lesion. They blew it off. MRI showed it was glioblastoma multiforme. It. Clarifying, it was missed by the ER physician assistant. The MD supervising them never spoke to me. Not even sure if they reviewed the case. Broken neck. No really. So this one guy was brought in with an ambulance for upper airway obstruction. We diagnosed what looked like an advanced throat cancer and did a tracheostomy. After the operation, where you pull and push the neck like crazy, we checked his neck x-ray and a junior asks when did he break his neck. He had a brand new and stable neck fracture. Checking his initial x-ray we see that it was there prior to the operation. After questioning the patient he said that on his way to the hospital the ambulance was in a car crash. No one bothered mentioning it to us when he eventually came in. He only thought he had some whiplash. But he was a few millimeters away from permanent paraplegia. Unfortunately he passed away about 2 weeks later due to the cancer. A PT presented with stroke-like symptoms, weakness on one side, blurriness, super high BP, etc. Works in the hospital. Told his manager he was feeling these symptoms and was directed to O&S. They saw him there and told him you're fine. Go to a walk-in clinic after work. He went back to work and luckily his manager was like nope. Go to the ER. We got him there and after a stat head CT he had a current intracranial infarct and 3 old infarcts never diagnosed. 4 strokes. And was told he was fine. Go to a walk-in clinic after work. Whoa. Not a doctor, but was just seen at the ER for extreme difficulty breathing. Been coughing for weeks. Talked to my doctor numerous times and she just kept recommending OTC remedies for cold, cough, fever. I asked if antibiotics would be something to look at since maybe this is pneumonia. Most likely not. Lungs sound fine. Take Mucinex. Was rushed to ER for the difficulty breathing. HR upwards of 200. Fever of 103. Tested for COVID. Came back negative. But they did the whole workup and found that my left lung was pretty much filled to the brim with gunk and my heart was being extremely stressed out by that. Pretty much nearly died. I have a follow-up with my doctor tomorrow. I'm going to let her know how well Mucinex worked. Had a literal pelvic exam for severe pain and something doesn't look right down there. Doctor and the gyno missed the fact I was having an organ prolapse. 91 days and 4 ER visits, calling it a heavy period. Later my female organs were no longer attached to my body but in a specimen cup in the trauma department. Also the whole thing ended in a hysterectomy to remove what didn't completely detach from my body. I'm telling this a second time on Reddit but I hope it helps someone. I was 26 and found a lump in my breast. Planned Parenthood had taught me self-checks and so I knew it felt different than a cyst. It felt exactly like the tumors I'd been taught to recognize. First doctor says you're too young for breast cancer. I didn't accept that and went to a second doctor where I got it hurts when I mash it right. Oh no. It gets bigger with your period, right? Oh no. Sure it does. Full stop. Third doc, you'll have an ugly scar if I biopsy it. Fourth doctor, I told him to call the police to get my naked topless self off his table because I wasn't leaving without scheduling a biopsy. It turned out I had stage 2 cancer and after surgery. 9 months of chemo. 3 months of radiation. And being told I couldn't have kids, I survived. I now have 3 kids and I'm 62 years old. If you think the doctor is wrong, get a second. Third, whatever opinion, listen to your suspicions. I'm a PT and patient was referred to me with low back pain and after evaluating him I referred him to the ER for suspected kidney issues. Obligatory, not a doctor. But I am a scientist. Last week I was left a bunch of blood films to look at by a colleague, who after a long night shift insisted they were mundane and I should just deal with them when I get the chance. I decided to clear them off immediately and the first film I looked at was a gentleman with a hemoglobin of 43, platelet count of 37 and a film jam-packed with blasts. It must have been about 40% blast cells. Naturally I'm immediately in acute leukemia mode. Ringing urgent care and the consultant who drags this poor man out of bed and into hospital. Spoke to the consultant today and was told the patient works offshore and is dealing surprisingly well with his condition. My colleague didn't miss the diagnosis, but did miss that film from his queue entirely. My husband had a weird dimpled spot on his back. Went to the dermatologist multiple times. Was brushed off and told not to worry about it. Derm even burned off a nodule that was bothering him at his belt line, but repeatedly said it was nothing and was visibly irritated with us for being anxious. He waited for nearly 10 years before going to another dermatologist, since our experience was so negative. Next derm immediately diagnosed what turned out to be a sarcoma which had 10 extra years to grow. My husband now has a 48-inch scar snaking down his back from the removal of the tumor and the reshaping of his back. I now have months of experience with wound drains, tunneling, bandages, triage and the laundry that comes with massive wound healing. I would like to take that first dermatologist who was so patronizing with our concerns and shove his face deeply into his own ass. PT here. Just yesterday tried to see a patient around 9 AM but he had to get a blood transfusion. So we chatted a bit and I said I'd come back later. Come back at 11:30 am and he's full on belly breathing. Extremely lethargic and unable to talk to me like he was before. Mentioned it to the nurse and she said she was aware but also didn't check on him. Came back again at 2 PM to find out that an hour after I said something, they decided he was having a reaction to his blood transfusion and it was finally stopped. He was headed to the ICU by the end of the day. Not a doctor, but a friend of my mom's went to an ophthalmologist for an eye problem. During his exam, he asked her, "So how long have you had MS?" That was the first she was diagnosed. She had been battling various MS symptoms for a couple of decades without a diagnosis. It's amazing how many diseases can be detected during an eye exam. Reading all of these comments makes me realize I have something that needs to get checked out. I've had this dull pain and swollen feeling in my upper left abdomen for about 5 years now. I've been to my doctor and gotten a couple tests done, but he said there's nothing wrong. I've always thought he was dismissive and arrogant. But now I know I need to get a second opinion soon. Myself. Went to 3 doctors each time to get checked up on a rash I had developed over my entire torso and legs. It was weird. Didn't itch or anything, but super noticeable and just stopped at my elbow and knees. Doctor said it was eczema. Gave me some cream. Did nothing. Went back and ended up seeing a different doc in the UK. So not hugely unusual. Who said it was probably an allergy. Recommended changing my washing powder. Did that, nothing happened. Went back again. Different doctor. Who reckons it was pityriasis rosa. Pretty benign. And to be honest, it looked like that. Told to wait. Even though I'd had it now for the best part of 3 months. Well, soon after this, I go to the clinic for my regular checkup. The nurse takes one look at me and says I have syphilis. So textbook, she asks if the student nurse can come in and look. 2 very painful injections later, and it clears up. So syphilis. I'm the patient in this story, but I still think it's worth saying. I started having horrible ankle pain when I would walk in grade school, and my doctor always attributed it to growing pains. I knew that was bull, and so I kept annoying him about it. After multiple attempts at diagnosis, everything from knock knees to pigeon toe to just being weak, I finally went to a specialist. He asks me to flex my ankle, and so I do. No. All the way, he said. Even though I was flexing as hard as I could only flex my foot maybe an inch from its resting position. Turns out, I had incredibly decreased mobility of that joint due to shortened tendons. He diagnosed me within 5 minutes. After years of my doctors brushing me off. After a few months of physiotherapy and a shoe insert, my pain decreased by a lot. I am 29 and been having chest pain for the past 3 years. First doctor I went to said that I was just stressing myself out thinking about it. The wife convinced me to go to another doctor who took me seriously and did an echocardiogram and sleep study. Turns out I have a pretty serious congenital heart defect that requires me to wear a pacemaker or I could die. The crazy part is up till 26 years old or so I was in amazing, near Olympic level shape. Doctor was stunned that I was still alive after explaining my workout routine when I was younger. I owe my wife my life now. I'm a dentist in the UK. While I was working as a locum in an emergency clinic, had a man present with a mouth of infections. He had wanted implants. Went to a private UK dentist who refused to do them due to the patient's heavy smoking and poor oral hygiene, which would mean the chance of success and good healing would be limited. The patient didn't accept this. Went online and found he could go to Hungary and get the implants done for half the price and have a holiday. Came back and within a few weeks most of the implants are infected and he's sat in my chair. We gave him antibiotics to clear up the infection, but then had to inform him that the implants would need to come out and he would need to find a specialist dentist with the necessary equipment to get that done. He was not happy. Spent all that money only to have to pay again to have them all removed. No better off and at least 10G down. Should have listened when the first person told him no. Obligatory, not a doctor. I'm working as a carer while I study nursing. Discovered a 90-plus-year-old woman had a broken hip that the nurse who assessed her after a fall completely missed. Most elderly people who break a hip will die within a year. Fast treatment is crucial and it's a pretty big thing to have missed. Another not a doctor. But my Mill had all the signs of stroke, severe headache, vomiting, vertigo, vision problems, partial paralysis, but was sent home from the ER and told it was an inner ear condition that would resolve on its own. When it did not get better, she saw her GP, who upon merely looking at her asked when she had had the stroke. When he realized it was still untreated, he immediately sent her back to the hospital. There they finally recognized that she had had a major stroke. She could easily have died and was in rehab for weeks. They then claimed that it must have happened after she was there the first time. Because, and this is really unbelievable, her chart from that visit did not say that she had had a stroke. So much wrong with that statement that I don't even know where to begin. Not a doctor, but I've been dealing with abdominal pain since a child. Countless ultrasounds, doctor appointments, visits. I was always told it was in my head. Recently had surgery for something unrelated. During the surgery they had to free my appendix that was stuck to my abdomen wall, and just the tip is healthy at this point. I've been suffering for years with a mild case of appendicitis and my body was pretty much just absorbing my appendix. I will have to go back to get it removed at a later surgery because it was so stuck all they could do was free it. And they didn't want to risk it at that point because it was going to cause more pain. So that was cool to find out.